evening, doctor. So today we have Dr. Jacob with us today, and he'll be clarifying your doubts and questions on the significance of rehabilitation in the life of seniors. So Dr. Jacob, please give us a brief about yourself.
To give an introduction about myself, I'm a physical medicine and rehabilitation specialist, or otherwise called a physiatrist. I take care of the entire spectrum of rehab-related problems, starting from pediatrics all the way down to geriatrics. And I'm happy to be associated with Athulya in managing the geriatric rehabilitation.
Okay.
Yeah.
So we'll go to the first question. So what is exactly rehabilitation for seniors? Like when and why would they need it?
So in terms of rehabilitation, it's a concept. It's a multidimensional and multidisciplinary team of rehab professionals who will be addressing multiple problems which the elderly face. So let's say, like, to give an example, an elderly patient, as they age, there's going to be a lot of problems, starting from vision, hearing, loss of muscle mass, bone weakness, etc., and then like neurodegenerative problems. So to address all these problems, you need a team of rehab professionals, and that's when the concept of rehabilitation itself comes into play. I think that would answer the question.
So when it comes to rehab and all those things, you get a lot of misconceptions, misunderstandings. So what is the biggest misconception that is often you get?
The biggest misconception, I would say, is rehab would be directly related to drug-related problems, and it is not the only rehab where it's associated with drug-associated problems. Rehab also includes other issues related to daily activities, and anyone who's not able to perform their daily activities of living, rehab comes into play. So helping them to get back to the previous lifestyle, which could have been hampered due to a disease or a condition. So we just try to help them to go back to the previous life using the rehabilitation concept by itself. And that's the first major misconception, especially in India, that people tend to think that it is drug related. The second thing is rehab would be correlated to majorly physiotherapy. Yes, physiotherapy plays a huge role in be it elderly or in terms of rehab, but there are other concepts or other professionals involved in the rehabilitation as a whole. So let's say, to give an example, there's speech therapists involved, there's occupational therapists, there's psychologists, nutritionists. So the entire team would form the rehabilitation concept. That's another common misconception, but I would accept the second one more commonly because they play a major role, especially we are talking about World Physiotherapy Day, so they play a major role in terms of addressing the day-to-day needs or making the elderly more independent in their life activities. So physiotherapy plays a major role as well.
Okay. So there's something called long and short-term procedures for everything, right? So can you tell us a little bit about rehab in long and short-term ways?
So long and short term, I would put it in terms of when we are addressing goals in a patient, and let's say, like, a patient, an elderly patient post 65, 70 comes to us with stroke, and then we are thinking of how we are going to achieve meaningful or productive life for the senior. So in that case, we would, after the initial evaluation, we would come up with a plan. It's going to be short-term, mid-term, and long-term goals.
So decided once they come in.
Yeah. So once we see the patient, and then we would involve the patient in the care, ask them what are their priorities. For some patient, they would have complete paralysis of one side after a stroke. But the patient the senior might say that I don't want to walk. Just let me be happy in the wheelchair, but he might have other priorities, like I wanted to communicate with my peers, or I needed to able to read properly. The stroke has affected my vision, so help me read better. I'm not bothered about walking. So in the patient, when the problem is more evident, where the patient has weakness in his upper limb and lower limb, it is always important to address what is the patient needed, the felt need of the patient. doesn't make sense you go and do other things which you can think you can make a difference. So that is always there. So we set short-term goals and long-term goals based on the needs of the patient.
Okay. So when you say you deal with stroke-related cases and all that, so when they are affected with stroke, it definitely affects their mental health too, right? So they'll be living a normal life and then it's just all, all like that. So does rehab really play a role in improving their mental health? If so, how do you do that? Like how do you make them back to their normal lives happily?
Yeah. So stroke, as I say, like it is a problem which affects the brain, and brain controls multiple systems in the body, starting from the movements in your muscles, being able to see, able to speak, and then swallow, etc. There's a lot of functions of the brain. Almost most functions brain has a part, and when a person has these many number of affections or impairments, obviously is going to be in a state of denial or depression.
Yeah.
So we would definitely have to address or put that as a priority, because it is not like easily 30% of patients with stroke end up being depressed. So what we do is, along with the initial evaluation, we do a screening. There's separate screening tools to assess if the patient is depressed. There's something called HADS, or Hospital Anxiety and Depression Scale. It's a very easy 15-pointer screening tool which we can just administer, and then we'll be able to understand, okay, the patient, is he going towards depression? And once we identify that, we can then involve in terms of adding medications to help to him feel better, and then putting him with a psychologist. If in case things are going very severe or out of hand, we involve the psychiatrist to give more support. So this would also play a major part in terms of rehab, the psychological or the mental health and well-being. So that is how I would put it in terms of.
So of course we'll have lots of types of rehabilitation, right? Can you name a few and how they are done and all that?
Speaking about seniors and elderly population, the types of rehabilitation, we can start from from neuro to orthopedic or musculoskeletal rehab. And when I say about seniors, it's geriatric rehabilitation. So geriatric is basically seniors, and then in geriatric rehabilitation we could do in terms of taking care of their cognition. We do cognitive rehabilitation and helping them to think better or maintain their cognitive abilities, at least if it's not going to decline. And then we have musculoskeletal rehabilitation, which basically elders have reduced the bone mass, or the bone density reduces with age, and if you don't have a regular or active lifestyle, it's going to end up being more bad. So we do use a musculoskeletal rehabilitation to help them achieve a good muscle mass, so that they don't end up having osteoporosis. We can prevent falls or prevent fractures. So that is musculoskeletal rehabilitation. And then we have neuro rehabilitation for people with Parkinson's, patients with other neurodegenerative problems, Parkinson's being the most common, multiple sclerosis. And then we have strokes and other brain-related issues. So we have neuro rehabilitation. The most common, I would say, would be neuro rehabilitation, and then which basically encompasses everything, be it cognitive rehabilitation comes under neuro rehabilitation, and the types could be endless, but I would say depends on the need of the patient. But rehab per se, for a normal person, we would try to prevent things from happening. For a person with some impairment, we'll try to improve, as simple as that.
So when we talk about seniors, it's like this huge topic, and when it comes to seniors, mental thoughts and everything, they just want to be alright the next minute, and for them it's all about surgery doctor. But how do you think they take rehab? Like do you think they feel offended by it? Or because in India, I think rehab is probably an offensive term that we use, drug, this and that. So how do you think seniors are evolving to this? Or
So that's a good question, because still we have not adjusted to the term rehab, and still, as I had answered the question previously, they immediately relate to something related to psychiatry or something related to drug abuse. But slowly things are changing. The concept is slowly coming into people's minds. And what I do is basically, rather than trying to sell what we want, I'll just asking them what they want to achieve. Every senior would have some need, as simple as, I wanted to read a newspaper every day in the morning, which I'm not able to do. I need to go to the toilet, which I'm not able to go to the toilet because of these problems. I was talking with my peers, which I'm not able to do. So by asking all these questions, you have a list of problems, and I can say that, okay, this is what rehabilitation does. So then they say, okay, I understand. Okay, rehab also involves taking care of all these issues. So we try to educate the patient before trying to tell them, okay, you need rehabilitation. So that way they tend to have good approach, and they reciprocate well also to the treatment.
Because it's like mostly when we say rehab, it's like we just think like, what is this, what's going on, something wrong with me, something like that. Okay, good. So like you talk about all these rehab education, this and that. So what kind of exercises do you give to the seniors? Not physically, but mentally. What do you tell them to do?
In terms of exercises, it has to be customized, and any exercise for the elderly, it has to be patient specific or person specific. Especially for the elderly, there's no one exercise regime which would fit everyone, because they could have multiple problems. We just have to take consideration of all these issues and then come up with an exercise plan.
So it's like per person?
Yeah, it has to be specified and customized. But however, there are some preventive exercise recommendations, like fall prevention. Mm-hmm. Fall prevention is one of the most common conditions which is affecting the elderly at present. So by giving simple advices in how to have your environment safe, how to walk properly, if in case you fall, how you should get up, and how to arrange the things around you. And those kind of general advices, I would say, like, would hold good for most seniors. But to answer your question, it is more customized. Okay. It would be more patient specific. And let's say, like, if a person is active, there's no any disease which the patient, or like condition which the patient or the senior is undergoing. As simple as being active, getting out of the chair and walking around, trying to take care of his activities or himself without depending upon others, that by itself is a good exercise, rather than trying to have a separate routine for that. So I would say that would be the best approach. Yeah.
Okay, great. So can we provide rehab for seniors who are bedridden? If yes, how can we do that?
Yes, obviously, as I mentioned before, for patients who are bedridden, which means that they would need more rehab than anyone else. The reason being, there's some severe implication either to the brain or the spinal cord or other hip or whatever problems which they are facing, which has caused them to be bedridden. So rehab, as I said, like, it would involve the team of specialists like physiotherapists, occupational therapists, speech therapists, based on depending on the need of the patient, what is the level of activity we are thinking. These rehab professionals would be involved.
So a whole lot of professionals involved.
And the important thing would be physiotherapists being involved from the beginning, because they play a major role in terms of preventing complications from happening. Let's say if a patient is lying in the bed, and just lying in the bed can cause a lot of problems. Patients can have pressure ulcers, they can lose their muscle mass very fast. Chances of fractures is going to increase. Patient can get disoriented. Patient could have delirium. You lie in one bed and then they get confused. They don't know the day and time, and all those issues can happen just by lying in the bed. But we may think, okay, he's resting.
Yeah.
And we have come across a lot of patients like this. You're just lying in the bed, and one day he became so confused. He started shouting. He's not sleeping at all. Another day.
That affects them mentally also.
Yes, a lot. Because a patient who's bedridden, there is no proper orientation to the environment. If the rooms are closed, and there's no daylight coming in, they won't know the time. And depending upon how severe is the problem, they may not even able to ask for things. So all those issues can cause severe problems. So by implementing simple physiotherapy, but simple exercises, simple joint movements can go in the long way in terms of helping a bedridden patient.
So are you able to get back to at least some mobility, or?
It should be possible, but it depends on what kind of problem we are had. Yeah,
it can happen.
It can happen, yes.
Okay, so there's one question. Can rehab be considered only for post-surgery, or can it be concerned for falls and pain? Who needs rehab?
I would say like everyone in that list for post-surgery, falls and pain, all should go through the rehab process. But it has to be specified and customized for each patient as needed. And in terms of post-op, depends on like what kind of surgery they have undergone. Let's say like if there is a hip or knee replacement, there will be specific instructions of do's and don'ts for this patient from the surgeon, and taking that input also in place and then implementing the physiotherapy program. For falls, the major thing we focus is to prevent fall from happening. So we focus more on teaching fall prevention exercises to the patient, and helping them manage falls if in case they fall, how to recover from the fall and all those things. So these are all areas, the major areas which rehab plays a major role, and physiotherapy also plays a major role here.
Okay. So how about pain management in rehab?
Pain management plays a major role. It is a part of the rehab. For example, let's say in rehab, pain management can be from medications, injections, using physiotherapy modalities like IFT or ultrasound, depending upon what level of problem we are handling. Let's say like the most common issue which the elderly come across is osteoarthritis knee, and they'll have knee pain. So we manage using medications, if necessary injections, and then we advise physiotherapy program by asking them using some wax therapy or IFT, and then some strengthening exercises. So this is how the complete plan, and everything would complement each other. But in the long run, the patient can't take medications forever for pain. Those medications and injections are more for the initial time when the pain is severe. But however, there's level 1 evidence which says that which is the highest known evidence, that exercises are the best treatment or therapy for knee pain or osteoarthritis. So they would, if they continue with the exercise program for long, there's good results, and they can push knee replacement to as long as possible.
Okay, so I have one last question. So can rehab be given at home for seniors? If we do, does it give the same results as in the hospital?
Yes, it does. It does. Recently there's been always institutional rehab everywhere at the hospitals, but staying at the hospital, it could be difficult due to several reasons. Could be financial, or it could be just staying in the hospital only can become very affect the patient. And then the earlier a patient gets back home is always better. So when we talk about rehab, it is just trying to get the patient back into the environment as early as possible. And yes, a lot of home rehab plays a major role, but there are limitations in terms of the level of support which we can have, or the equipments which we can use at home is going to be restricted. But it is definitely possible, and with a lot of technology and we are able to do a lot of home-based rehab also, and it does give good results because the patient is in their comfort zone, and everything is known around, and it can especially in this situation with COVID around, and it's not advisable for the elders to travel frequently. So in that cases, it is always better for home-based therapies and home-based rehab, and it does play I would say a more equal role between institutional. Yeah. And eventually patient, for elderly patient, be it post-operative or pain or any other chronic condition, um, whatever institutional rehab which they are undergoing has to be translated to home also. So the rehab never stops, from the hospital or from the rehab institute. It just had to get back to their place where they're living. So that's when it becomes more a successful rehab program. Yeah.
Okay, then I think that's it. So thanks, doctor, for taking your time to answer all my questions. It was really informative, and I'm hoping to I'm looking forward for more such sessions with you.
Sure.
On various other
Thank you.
topics.
Thank you. My pleasure. Thanks.
Thank you.